Hello, welcome to Anatomy DAHAR series. Today's topic is temporomandibular joint. Illustrated and presented by Dr. Abdul Hamid, Abdul Rashid. Introduction. Look at the diagram. This is the posterior view of base of the skull, that is the cranium, and the lower jaw mandible. The temporomandibular joint, acronym is TMJ. It is the articulation between the temporal bone of the cranium and the lower jaw mandible. It is the most used joint in the body. The unique features of this articulation is that a single bone, the mandible, articulates bilaterally with the right and left parts of the base of the cranium and formed two temporomandibular joints. Though anatomically distinct, they act together as a single unit functionally for opening and closing the mouth and complex chewing, that is called mastication, and side-to-side movements of the lower jaw. Base of the cranium. In this slide, we have two diagrams, diagram A and diagram B. Diagram A is the inferior view of right half of the cranium. Here you will see many bones forming the base of the cranium, but we are going to concentrate only one bone here called temporal bone. Temporal bone, if you look from below, you can see there are two parts. Number one, red color, is squamous part of the temporal bone. Number two, behind this is a green color, small piece, is the tympanic part of the temporal bone. So from inferior you can see squamous and tympanic parts of the temporal bone. If you see in this diagram B, you see the same things but in bigger size. This part, red part, is the squamous part of the temporal bone, both sides, and then the green one is called tympanic part of the temporal bone. Between the squamous part and tympanic part, there's a little long, narrow gap is there called squamotympanic fissure. Between the squamous and tympanic part, narrow fissure is there called squamotympanic fissure. Anterior to the fissure is the fossa, we call mandibular fossa, number 3, and anterior to it is the tubercle is there called articular tubercle. Both mandibular fossa and articular tubercles are on inferior surface of the squamous part of the temporal bone. We have two diagrams in these slides. We are looking from the right lateral side. The upper one is the temporal bone. This is squamous part of the temporal bone. This is zygomatic part of the temporal bone. This is external acoustic meatus. This is mandibular bone. This is head of the mandible, and this is neck of the mandible. Architecture of the temporomandibular joint. Temporomandibular joint is formed by two bony structures with articular surfaces. They are superiorly oval-shaped mandibular fossa on the inferior surface of the squamous temporal bone. Here, this is mandibular fossa in the inferior part of the squamous temporal bone, and anterior to it is articular tubercle at the root of the zygoma. We have already mentioned this one in the previous slides. Behind the mandibular fossa is a fissure which is between the squamous part and tympanic part, called squamotympanic fissure. Inferiorly, it is the head of the mandible. Long axis of the head of the mandible is side to side, that is between lateral and medial, and anteroposterior length is half of the side to side length. So anteroposterior is flattened, side to side is longer. This is the diagram, posterior view of the cavities of the temporomandibular joints. Let's talk about the type of temporomandibular joint. The temporomandibular joints, that is TM joint, is a synovial joint of condylar variety. It is an atypical synovial joint. Why? Because in typical synovial joints, the articular surfaces are covered by hyaline cartilage. However, in temporomandibular joint, the articular surfaces are covered by fibrocartilage and not by hyaline cartilage. In addition, the temporomandibular joint is completely divided by an intra-articular disc into two cavities. Look here. This is intra-articular disc, dividing the cavity into two. They are above the disc is the superior cavity, and below the disc is inferior cavity, also known as superior compartment and inferior compartment. This is the diagram of seen from the right side, right lateral view. This is in front, this is behind. This is margins of the mandibular fossa. In front of this fossa is the articular tubercle. This is the margins of the articular tubercle. And behind the mandibular fossa, we have squamotympanic fissure separating the squamous part from the tympanic part of the temporal bones. This is neck of the mandible. Let's talk about fibrous capsule. This is the fibrous capsule. The temporomandibular joint is enclosed in the fibrous capsule. It is attached above and anterior along the margins of the articular tubercle, and behind it, that is on the lateral and medial side, is fibrous capsule is attached to the margins of the mandibular fossa. Posteriorly, this fibrous capsule is attached to the squamotympanic fissure. Below and anterior, the fibrous capsule is attached around the upper part of the neck of the mandible, near the articular margins of the head. Posteriorly, at the lower down the neck. The capsule is loose above and tight below the intra-articular disc. This diagram is again right lateral view of the temporomandibular joint, and this is the capsule of the temporomandibular joint we have already just mentioned. Now we are going to talk about lateral temporomandibular ligament. Lateral temporomandibular ligament is the lateral thickened part of the capsule. It passes obliquely down and back from the articular tubercle above and to the lateral surface and the posterior border of the neck of the mandible. So from the articular tubercle to the neck of the mandible is posterior and lateral surface. This ligament prevents posterior dislocation of the temporomandibular joint, and also it prevents fracture of the tympanic plate, which is behind. Next is synovial membrane. As temporomandibular joint is a synovial joint, atypical synovial joint, it also consists of synovial membrane. It lines the inner surface of the capsule of the temporomandibular joint and also line the intracapsular inside the joint, but non-articular surfaces of the neck of the mandible. It is lining the non-articular surface of the neck of the mandible inside the joint. This is the diagram of interior of right temporomandibular joint. You can see here, this is the mandibular fossa and this is articular tubercle of squamous part of the temporal bone. This is head of the mandible. This is capsule of the temporomandibular joint. And this is intra-articular disc of the joint. Let's talk about the intra-articular disc of the temporomandibular joint. Meniscus means disc of crescent-shaped, concave or convex structures. Intra-articular disc of temporomandibular joint is an oval-shaped fibrocartilaginous disc that divides the temporomandibular joint into two compartments, superior and inferior compartments. We have already mentioned this one earlier. Now let's talk more detail. The superior compartment, this is the one, which is above the disc, that is between the disc and the mandibular fossa of the temporal bone. It is also called menisco-temporal compartment, that is meniscus and the temporal bone. It permits gliding movements of the TM joints. The inferior compartment is below the disc. This is the inferior compartment below the disc, between the disc and head of the mandible. Because of that, we call it again menisco-mandibular compartment. It allows rotatory and gliding movements of the TM joints. Though termed fibrocartilage, the disc consists mainly of collagen fibers with few cartilage cells. Attachments of the intra-articular disc. Diagram A is showing inside the temporomandibular joints. You are looking at this is the intra-articular disc and these are the capsule. In diagram A, we are going to talk about the peripheral part of the intra-articular disc attachment. Peripheral part of the intra-articular disc, which is also called annulus, is attached to the inner surface of the capsule of the joint and also to the medial and lateral poles of the head of the mandible. In this diagram here, this is the capsule. It is attached. Peripheral part, the annulus part will be attached to the capsule here. The second diagram B showing the anterior attachments of the intra-articular disc. Through the capsule, anterior part of the intra-articular disc is continuous with the upper part of the tendon of the lateral pterygoid muscles. You can see here, it is attached to or continuous with the tendon of the upper part of the lateral pterygoid muscle. The disc is regarded morphologically a part of this muscle. Continuation of the attachments of the articular disc. We know that this is the mandibular fossa and this is head and neck of the mandible. Posteriorly, the articular disc splits into two laminae or two layers, superior lamina and inferior lamina. Superior lamina is attached to the posterior part of the margins of the mandibular fossa, and the inferior lamina is attached to the back of the neck of the mandible. Superior lamina is fibroelastic. Inferior lamina is non-elastic fibrous tissue. Between the two laminae there's a little gap here. It is filled with a pad of loosely textured tissue containing many blood vessels and sensory nerve endings here. Let's continue the intra-articular disc. Let's see the diagram here. This is the sagittal section of right temporomandibular joint. This is anterior, this is posterior. This yellow color is the intra-articular disc. The surfaces of the intra-articular disc. Intra-articular disc consists of two surfaces, superior and inferior. This is superior surface and this is inferior surface. When you cut sagittal section and see very carefully, from anterior to posterior, the superior surface is concavo-convex. Superior surface from anterior to posterior is concavo-convex. The inferior surface is concave here in adaptation to the condyle of the mandible. If you see very carefully, intra-articular disc has two areas a little bit thickened called bands, anterior and posterior bands. Let's talk about the zones of the intra-articular disc. In sagittal section, intra-articular disc composed of 5 zones. Zone 1, Zone 2, Zone 3, Zone 4 and Zone 5. Zone 1 is the anterior extension and Zone 2 is anterior thickened band. Zone 3 is intermediate thin zone, relatively avascular. Zone 4 is posterior thickened band and Zone 5 is bilaminar regions. These two bands ensure that the disc moves forwards and backwards with head of the mandible during protraction and retraction. Functions of the intra-articular disc. As you know, intra-articular disc is made up of fibrocartilage and thus it acts as a cushion and helps in shock absorption. Superior surface of the articular disc glides underneath the articular surface formed by mandibular fossa and the articular tubercle of the temporal bone. Inferior surface of the articular disc provides the rotation and gliding movements of the head of the mandible below. It is also responsible for the stabilizations of the condyle by filling up the space between the articular surfaces. Applied anatomy of the intra-articular disc. When the articular disc is detached from the fibrous capsule, it is called derangement of the joint. It causes painful movements and clicking sound while opening and closing the mouth. Relations of the temporomandibular joint. In these slides, we have two diagrams. Diagram A is left temporomandibular joint seen from inside. That is medial view of left temporomandibular joint. This is anterior, this is posterior. Diagram B is right temporomandibular joint seen from behind. So this is lateral, this is medial. So now we are going to talk about the relations, superior relations of the temporomandibular joint. Look at the diagram A. Above the temporomandibular joint is middle cranial fossa and you will see middle meningeal artery above the temporomandibular joint. Inferior relation in both diagrams, in figure A and figure B, below the joint is maxillary blood vessels. This is number 2. Same thing below the joint is maxillary blood vessels, number 2. Lateral relations of the joints, we use figure B. This is lateral, this is medial. Lateral relation is, there is the lateral ligaments of the TM joint, and you will see branches of the facial nerve, number 3, covered by parotid gland on the lateral side and covered by the skin. They are the lateral relations of the TM joint. Medial, if you see here in figure A, middle meningeal artery. Medially, you have middle meningeal artery is there, and in both picture you will see maxillary vessels and auriculotemporal nerve. This is a branch coming from the mandibular nerve. Auriculotemporal nerve will be here on the medial side, coming from here, as it's coming from behind, is on the medial side. So this is the medial relations of the temporomandibular joints. Relations of the temporomandibular joints. Continuation. We have two diagrams here, diagram A and diagram B. Diagram A is left temporomandibular joint. You are looking from lateral side. Lateral view of the left temporomandibular joint. This is in front and this is behind. This is right temporomandibular joint looking from behind. So this will be lateral, this will be medial. Now let's talk temporomandibular joint. Anteriorly, you will see there is the lateral pterygoid muscles comes and insert there. And posteriorly, if you see very carefully, even in figure A, you can see posterior relation is the external auditory medius is there. And in figure B, this is the auriculotemporal nerve coming from the mandibular divisions of the trigeminal nerve. And you will see here superficial temporal vessels be there. And you can see part of the parotid gland will be behind this joint. Ligaments of the temporomandibular joint. Accessory ligaments. In addition to lateral temporomandibular ligament, which we have stated earlier, the temporomandibular joint has two more accessory ligaments. They are number 1, sphenomandibular ligament, and number 2, stylomandibular ligaments. Both limit the lateral movement of the temporomandibular joint. Number 1, sphenomandibular ligament. It is attached above to the spine of the sphenoid, number 3, and below it is attached to the lingular process and the margin of the mandibular foramen on the inner surface of the mandible, number 4. Sphenomandibular ligament lies deep, that means medial to the fibrous capsule of the temporomandibular joint in the infratemporal fossa. It is a remnant of the dorsal part of the Meckel's cartilage. Relations of the sphenomandibular ligament. This diagram is the medial view of the left sphenomandibular ligament. Left sphenomandibular ligament, medial view. Lateral relations of the sphenomandibular ligament, that is lateral pterygoid muscles, which is outside the sphenomandibular ligament. It is not shown in this diagram. Next structures on the lateral side of this ligament is number 1, auriculotemporal nerve. This is the one lateral to the ligament, which comes from the third division of the trigeminal nerve, that is the mandibular nerve. And number 2, maxillary blood vessels. Both are lateral to the sphenomandibular ligament. Relations of the sphenomandibular ligament. Continuation. This is the diagram of the mandible. Posterior view of right half of the mandible. This is the right half of the mandible posterior view. This is medial side and this is lateral side. This is sphenomandibular ligament superiorly attached to the spine of the sphenoids. So what are the structures deep to this ligament, that is medial to this sphenomandibular ligament? Number 2, cauda tympani nerve, a branch of the facial nerve. Number 3, medial pterygoid muscles. Number 4, wall of the pharynx. And number 5, showing lower end of the sphenomandibular ligament pierced through by inferior alveolar nerve and vessels. On the lateral side of the sphenomandibular ligament we have number 6, maxillary blood vessels. Number 7, middle meningeal vessels coming out from the maxillary artery. And number 8 is inferior alveolar nerve and vessels. They are lateral to the sphenomandibular ligament. Next accessory ligament of TM joint is stylomandibular ligament. This is the one, stylomandibular ligament. It is a band of thickened deep cervical fascia which separates the parotid and submandibular salivary glands. It is attached superiorly to the lateral surface of the styloid process. Number 2. And inferiorly it is attached to the angle and the adjacent posterior border of the ramus of the mandible. This is the area. Superiorly to the styloid process, inferiorly to the angle and the adjacent border of the mandible. This ligament becomes taut when the mandible is protruded. Continuations of relations of stylomandibular ligament. Let's see the diagram again. This diagram is also posterior view of right half of the mandible. So this is right half of the mandible looking from behind. So outside is lateral, inside is medial. So what are the structures we are going to talk about? What are the structures related lateral and medial to stylomandibular ligament? Lateral to the stylomandibular ligament structures are skin, parotid gland, and temporal branches of the facial nerve. Structures medial or deep to stylomandibular ligaments are number 4, maxillary vessels. Number 5, auriculotemporal nerve. Number 6, middle meningeal vessels. Number 7, spine of the sphenoid. From there, sphenomandibular ligament is coming down. And number 9 is cauda tympani nerve. These structures are deep or medial to the stylomandibular ligament. Relations of the stylomandibular ligament. Continuations. In this slide, we have two diagrams, diagram A and diagram B. Diagram A is we are looking the mandible on the left side, that is left lateral view. Diagram B is right half of the mandible looking from behind. Let's go back to diagram A. Now, anterior relations of stylomandibular ligament. If you see very carefully, this is the ligament. Anterior and above is temporomandibular joint, and anterior to it is tendon of the lateral pterygoid muscles. Superior and posterior to this ligament is external auditory meatus. If you come to this diagram, looking from behind, stylomandibular ligament, posterior and lateral to it, if you see parotid gland, and you will see the superficial temporal vessels and temporal branches of the facial nerve, and superiorly is the auriculotemporal nerve will be here. These are the relations of the stylomandibular ligament. Movements of the temporomandibular joint. There are three sets of mandibular, that is the lower jaw movements at the temporomandibular joints. They are, number 1, depression and elevation of the lower jaw to make the mouth open and close respectively. 2, protraction, that is protrusion and retraction, retrusion of the lower jaw. And 3, side to side, that is grinding, chewing movements of the lower jaw. Two groups of muscles are involved in movements of the temporomandibular joint. They are main group of muscles and accessory muscles of mastication. A. Opening of the mouth. 1. Slight opening, that is less than 22 mm. Heads of the mandible rotate around the transverse horizontal axis, that is the fulcrum, in the hinge-like movement. This is the one head. Here is the axis, transverse axis, which is the fulcrum. It occurs in the lower compartment of the TM joint, between the inferior aspect of the disc and head of the mandible, that is meniscomandibular compartment. It is done by the action of lateral pterygoid muscles and gravity. Continuation or opening of the mouth. Let's see the diagram. This is the head of the mandible. This is fossa for the head, and this is articular tubercle. Let's talk the second one, wide opening of the mouth. Rotation of the head of the mandible in slight opening of the mouth is followed by gliding of the disc and heads of the mandible forward and downwards to the articular tubercle. That means in wider opening, the head is now together with the disc glides forwards to beneath the tubercle. It is taken place in the upper, that is meniscotemporal compartment, and called translation. In this sequence of events, the mandible is depressed further by 1. Digastric muscle, 2. mylohyoid muscles, and genohyoid muscle. They are above the hyoid bone and called suprahyoid muscles, while the infrahyoid muscles, which are below the hyoid bone, act to stabilize the hyoid bone. They are infrahyoid muscle. Fulcrum means the point on which it turns or rotates. When slight opening of the mouth, head of the mandible rotates in the inferior compartment of the TM joint. Then the head is the center or fulcrum in this movement. But in wide opening of the mouth, the articular disc and head of the mandible glide forward together. The whole mandible rotates. The head is now moving forward along the circumference to the new position in front. Originally from here, it moves now forward as the whole mandible rotates. As the whole mandible rotates, see red arch, its center, the fulcrum of the arch also moves slowly along the sphenomandibular ligament to the new position, that is the mandibular foramen on the medial surface of the mandible. As you know, at first the fulcrum was here, but later when the whole mandible rotates, the fulcrum is no more there. Fulcrum becomes center of this arch, then this is the place. It moves down along the sphenomandibular ligament, finally reach to the new place at the mandibular foramen on the medial surface of the mandible. C. Closing of the mouth. It is the reverse movements of the opening of the mouth, gliding backwards of the articular disc and the head in the upper TM compartment, followed by reverse rotation of the head of the mandible in the lower TM compartment. They are done by 1. Temporalis muscles, 2. masseter muscles, and 3. medial pterygoid muscles. D. Protraction, that is forward movements of the mandible. Both articular discs and heads of the mandible together glide forwards in the upper TM compartment, that is meniscotemporal compartment, but without depression or elevation of the mandible. Both masseters and all 4 lateral and medial pterygoids are involved in such movement. This is lateral pterygoid, this is medial pterygoid, and this is masseter. So all 4 muscles, all these muscles on both sides will act in this action. Number E. Retraction, that is backward movement of the mandible. That is a reversal of protraction. In this case, both articular disc and head of the mandible together glide backwards in the upper TM compartment, that is meniscotemporal compartment. In this movement, the muscles involved are number 1, middle and deep fibers of the masseter, and number 2, digastric muscles, assisted by genohyoid muscles. F. Side to side, that is chewing movements of the mandible. Let's see the diagram. Superior view of the mandibles. Let's concentrate number A. You see here, this is head of the mandibles. This is right head of mandible. This is left head of mandible. Let's start. Right head of the mandible glides forwards together with its articular disc, like in protrusion. It is due to the actions of medial pterygoid, lateral pterygoid, and masseter of same side, ipsilateral side. At the same time, on the left side, that is left head of the mandible, merely rotates on its vertical axis. There is no gliding movement is there. As a result, the chin moves forwards and towards the left side. The rotating part, this part, is called working part. This is one, WP. But the opposite one, which is non-rotating part, is called non-working part, NWP. These movements occur alternately in right and left TM joints for side-to-side movements. Clinical highlights. The anterior dislocation of the temporomandibular joint is the most common form of displacement. The mandible dislocates anteriorly only. In the opening of the mouth widely, the heads of the mandible not only rotate in the lower compartment of the TM joint, but together with the articular disc, glide anteriorly in the superior compartment until they reach beneath the summit of the articular tubercle. In this position, the joint is unstable and a minor blow on the chin or sudden spasm of the lateral pterygoid muscles, as in yawning, may pull the disc together with the head of the mandible forward beyond the tubercle, because the disc is attached to the lateral pterygoid muscles. In bilateral cases, the mouth is locked in an open position and cannot be closed back. The reduction of the dislocated mandible by itself is prevented by spasms of the muscles around. The reduction is done manually as follows. The mandible is pressed down and posteriorly by external pressure using gloved thumb on each side of the lower molar teeth. The disc and the head of the mandible come below the summit of the articular tubercle. They are slowly pushed backward till the heads return to the mandibular fossa behind the tubercle. Blood supply of the temporomandibular joint, maxillary artery and superficial temporal arteries. They are branches of the external carotid artery. Nerve supply of the TM joint. It follows the Hilton's law. That means any nerve which crosses the joint will supply the joint. They are auriculotemporal nerve enters from behind. The mesenteric nerve enters from in front. Both are branches of the mandibular divisions of the trigeminal nerve, V3. Except for the geniohyoid muscle, which is innervated by the C1 spinal nerve, all the muscles that move the TM joints are innervated by mandibular nerve, that is the third divisions of the trigeminal nerve. Lymphatic drainage of the TM joint. Drain to superficial parotid, that is pre-auricular nodes, deep parotid nodes, and upper deep cervical, that is jugulo-digastric nodes, Robbins level 2. The end, illustrated and presented by Dr. Abdul Hamid, Abdul Rashid. Now is a good time to subscribe to our Anatomy DAHAR series channel. You will be notified as soon as our next video is available to you. Anatomy DAHAR series also provides other videos related to the present topic. Enjoy and thanks for watching.